it's me, your nurse Anna. So for today's videos, I'm going to perform on how to administer oral and nasal suctioning. So since we have oral and nasal suctioning to be performed, let me explain first why is it necessary to perform these two. So suctioning via the oropharyngeal or mouth and nasopharyngeal or nasal routes is performed to remove accumulated saliva, pulmonary secretions, blood, vomitus, and other foreign material from these areas that cannot be removed by the patient's spontaneous cough or other less invasive procedures. So, nasal and pharyngeal suctioning also performed in a wide variety of settings that would include critical care units, emergency departments, inpatient acute care, skilled nursing facility care, and home care, and also an outpatient or ambulatory care. So, suctioning is indicated when the patient is unable to clear secretions and or when there is audible or visible evidence of secretions in the large or central airways that persist in spite of the patient's best cough effort. The need for suctioning is evidenced by one of the more of the following. This would include visible secretions in the airway, a chest auscultation of course, gurgling breath sounds, rhonchi or diminished breath sounds, and also if the patient reported feeling of secretions in the chest or suspected aspirations of gastric or upper airway secretions, and clinically apparent increased work of breathing, also restlessness and patient reported unrelieved coughing. And also, in emergent situations rather, a provider order is not necessary for suctioning to maintain a patient's airway. However, routine suctioning does require a provider care. So before we begin the procedure, first we assess the patients first. So before facing our patient, we have to make sure that we check our patient chart. So according to my patient chart, she has no known cause of allergies, and that is her date of birth is 122803. And we have also to make sure that all the materials needed is at her bedside already. These are the materials needed to be used in the procedure. We have a suction kit and pulse oximeter, and we have also a sterile solution, our sterile basin, and our surgical gloves, hypoallergenic powder free, and also our drape pad. Hi, Miss Christine. It's Anna, your nurse for today. So, for today, I'm going to perform the oral and nasal suctioning. How are you today?
I'm fine.
So, it seems like your breathing is a little bit labored and that you have a congestion in your chest. Can you tell me your name and birth date?
My name is Christine Salvador and my birthday is December 28.
Okay, great. So, okay, Miss Christine, are you having any pain?
No.
So, Miss Christine, I'm just gonna put a little catheter down your nose and get some phlegm secretions out of your chest to make your breathing easier, and that would make you feel better. Is that okay with you?
Yeah.
Are you comfortable with your position?
Yes.
Okay, and I will get going to get all the things set up. So, Miss Christine, do you have any trauma to your place?
No.
So, I'm gonna turn this suction on 100 to 150. Okay. So, Miss Christine, I'm going to put a pulse oximeter at your finger to check your autosat. So, 83, 87. Oh, that's too low, Miss Christine. I hope that this procedure will make you feel better. So now I'm going to put a drape pad on your chest. So we are going now to connect the tube in the suction. Then control the suction over my right hand. And then we have to pour a sterile solution in our sterile basin. Since I am done washing my hands and provide some privacy to my patient, so I am now going to wear a gloves. So I am done wearing my surgical gloves, so let's begin and let's proceed with our procedure. Okay, so Miss Christine, I am about to insert it to your nose. It might be a little bit of uncomfortable. Is it okay with you?
Okay.
Okay. So after inserting the suction catheter to our patient's nostril or nose, we have to make sure that we clear our suction catheter so that we will proceed already to our oral suction. So we have also to dip our suction catheter one more time to lubricate the suction or suction. So okay, Miss Christine, I am about to insert the suction to your mouth so that if there is anything else at the back of your throat that we cannot get it here, so we can insert it. So kindly open your mouth. So kindly close your mouth already. Thank you. So ma'am, how does it feel?
Great. It's okay.
Okay, thank you. So, Miss Christine, I'm about to do our oral care to you. Okay, thank you. So, okay, Miss Christine, let me see your pulse oximeter. Oh, it's 93. That's great. There is an improvement. So, after all the procedure that we implement, we are about to throw away the materials that we use in the procedure, including our drape pad and also our gloves. After putting away all the materials that we gonna use, perform always a hand hygiene before and after the procedure. So after all the procedures that we've done, we are about to reposition our client in a comfortable position and document the findings at nurse's station. Thank you. After implementing the procedure, I'm about to document my findings to my patient chart. That would include the assessment of respiratory before and after suctioning and the size of suction catheter to be used, and also the amount of negative suction pressure to be used and the duration of suctioning period and the routes used to be suctioned and the secretions obtained, the color, the odor, the amount and consistency, and also the frequency of suctioning, and also our patient's tolerance of the procedure. So that's all for the oral and nasal suctioning. Thank you.